Why your sleep position matters for heart health and what to do about it. Hello, and welcome to the U.S. Health Guide. Have you ever woken up wondering if the way you slept actually helped or hindered your heart? It sounds like a small detail, but what if your sleep position could be silently impacting your cardiovascular health? We all know sleep is vital for energy and mood, but its profound connection to heart health is often overlooked. And here's the kicker: your sleep position might play a more significant role than you think. In this video, we are going to uncover the science behind how sleep duration, quality, and yes, even your favorite sleeping posture can affect your heart. Get ready to transform your nights into a powerful ally for a healthier heart. Before we dive into positions, let's establish the foundation. The quality and quantity of your sleep are absolutely paramount for your heart. The American Heart Association recommends adults get 7 to 9 hours of sleep per night. It's a sweet spot. Too little or even too much can increase your risk of heart disease and stroke. But it's not just about the hours. Poor sleep, whether it's insufficient, interrupted, or due to disorders like insomnia or sleep apnea, puts immense pressure on your cardiovascular system. During healthy sleep, your blood pressure naturally dips. Lack of sleep disrupts this, leading to sustained high blood pressure, a major risk factor for heart disease. Chronic sleep deprivation also triggers inflammation and elevates stress hormones like cortisol, damaging your arteries over time. Furthermore, poor sleep messes with your metabolism, increasing insulin resistance and the risk of type 2 diabetes, another big heart threat. It also impacts your mood, leading to stress, anxiety, depression, and unhealthy choices like poor diet and less physical activity, all indirect hits to your heart. For those with sleep disorders, the stakes are even higher. Sleep apnea, where breathing repeatedly stops and starts, forces your heart to work harder due to reduced oxygen, significantly increasing risks of arrhythmias, heart failure, and high blood pressure. The good news is that treating sleep apnea can actually improve heart problems. What's truly fascinating is that sleep isn't just about preventing heart issues. It actively participates in healing a damaged heart. Research shows that after a heart attack, the brain releases sleep-promoting factors that aid cardiac recovery. Mice deprived of sleep post-heart attack showed worse heart function and higher mortality. This means prioritizing sleep is crucial for both prevention and recovery. Now let's talk positions. For most healthy individuals, there's limited evidence that one specific sleep position is inherently better for overall heart health. The best position is ultimately the one that allows you to get quality, restorative sleep. However, there are crucial exceptions where your sleep posture can make a significant difference. Many people with heart failure, especially those with an enlarged heart, find it uncomfortable to sleep on their left side and often prefer sleeping on their right. The exact reason isn't fully understood, but it might relate to changes in heart positioning or increased pressure on the lungs. If you have heart failure, also avoid sleeping on your back, as it can worsen breathing problems and sleep apnea symptoms. Elevating your head can help. If you snore or have sleep apnea, sleeping on your back is generally the worst position. It allows your tongue and jaw to fall back, obstructing your airway. Side sleeping, either left or right, is highly recommended as it helps keep your airway open, reducing snoring and mild sleep apnea. If you suffer from heartburn or GERD, sleeping on your right side can worsen symptoms. The recommended position is to sleep on your left side, as it's associated with less acid exposure and faster esophageal clearance. For expectant mothers, especially in the later stages, sleeping on your left side is generally advised. This helps prevent the uterus from compressing major blood vessels like the inferior vena cava, ensuring better blood flow to both you and the baby. Sleeping on your right side is also considered safe. Avoid sleeping on your back in the third trimester. Sometimes, sleeping hunched over on your side can increase internal pressure, potentially causing palpitations. If you experience this, try changing your position, taking deep breaths, or drinking water. Persistent or worsening palpitations warrant a doctor's visit. Some studies have noted subtle, temporary changes in heart's electrical activity, ECG readings, when healthy individuals sleep on their left side. This is thought to be due to the heart shifting position. However, these changes are generally not clinically significant and don't indicate actual harm to the heart in healthy people. Remember, comfort is key. If a position causes discomfort or pain, it will disrupt your sleep, leading to poor quality sleep, which does negatively impact your heart. So how can you optimize your sleep for a healthier heart, regardless of your preferred position? It all comes down to excellent sleep hygiene. First, maintain a consistent sleep schedule by going to bed and waking up at the same time every day, even on weekends. This regulates your body's natural sleep-wake cycle. Second, create an ideal sleep environment by keeping your bedroom cool, dark, and quiet, and removing allergens like dust by regular cleaning. Third, be mindful of your eating and drinking habits. Avoid heavy meals, caffeine, and alcohol a few hours before bed, as alcohol might make you drowsy initially but disrupts sleep quality. Fourth, engage in regular physical activity daily, but avoid intense workouts too close to bedtime. Fifth, limit screen time. The blue light from phones, tablets, and TVs can interfere with melatonin production, so power down at least an hour before bed. Sixth, manage stress by practicing relaxation techniques like deep breathing, meditation, or yoga to calm your mind before sleep. Finally, establish a consistent bedtime routine to signal to your brain that it's time to wind down. A warm bath, reading, or gentle stretching can be helpful. It is crucial to know when to seek medical advice. If you experience persistent symptoms like shortness of breath, chest pain, or palpitations linked to sleep, or if you have a known heart condition and notice changes in your sleep, talk to your doctor. Symptoms of sleep apnea like loud snoring or excessive daytime sleepiness also warrant a checkup. Your healthcare provider can help identify underlying issues and guide you to better sleep and heart health. In summary, while your sleep position can matter in specific health scenarios, the overarching message is clear. Prioritizing quality, restorative sleep is the single most important thing you can do for a healthy heart. Your heart works tirelessly for you, even when you're dreaming. Give it the rest and recovery it deserves. By implementing these simple sleep hygiene practices and being mindful of your sleep position when necessary, you're taking powerful steps towards a healthier, happier life. If you found this video helpful, please give it a thumbs up, share it with someone who needs to hear this, and subscribe to the US Health Guide for more science-backed health insights. What's your favorite sleep position? Let us know in the comments below. Thanks for watching and sleep well.